Hi, I'm Dr. Kathleen Latino. Did you know that about 3% of patients with prostate cancer will have some type of genetic mutation? However, that percentage increases to 10 to 12% in patients with higher risk disease. A genetic mutation is an alteration in the DNA in the cells in your body. This alteration can be something that you are born with or a change that occurs after birth. Sometimes mutations happen in cancer after it forms. So how is genetic testing done? Genetic testing involves a blood test that looks for changes in your genetic profile. In some cases, your actual tumor can also be tested for mutations. You may wonder how the genetic testing information will be used by your doctor and if it will provide any benefits to you and your family. The results of genetic tests can help to determine the chance of developing or passing on certain inherited forms of prostate cancer. It can also help the doctors make medical recommendations regarding the detection and treatment of your cancer. Genetic testing is also a valuable tool when checking for certain inherited syndromes that may put you at risk for developing other specific types of cancers. The one syndrome that is particularly important in urology is Lynch syndrome, an inherited disorder that increases the risk of the number of cancers including colorectal, endometrial, and other cancers. You may also wonder if your insurance will cover the cost of tests. Genetic testing can be very expensive, but most insurance companies, including Medicaid and Medicare, provide some amount of coverage, with the amounts varying from plan to plan. The IMP lab will verify your insurance coverage before running any genetic testing. People are often worried about whether the genetic testing results may affect their ability to obtain health insurance, or if the findings will cause their premium to increase. A federal law known as GINA, the Genetic Information Non-Discrimination Act, prohibits health insurers from making decisions about whether they wish to cover you, if they will continue your existing policy coverage, or what your health insurance policy premium will be, based on the outcome of this genetic testing. It also protects you should a change in your insurance plan occur. One cautionary note, the law currently does not pertain to life insurance. If you are thinking of purchasing a life insurance policy in the future, it is best to have that in place prior to doing the genetic testing. Genetic testing can have emotional effects. Some patients find the knowledge empowering, but others find the information overwhelming. We recognize and understand both positions and believe that you should give careful thought to this testing option and discuss it with your family members prior to making the decision to proceed. You may want to see a genetic counselor to get a better understanding of the information which the test may provide and the potential impact of the results. Genetic counseling is available on Long Island and throughout the tri-state area. Your doctor can provide you with a list of genetic counselors convenient for you. Medicare and Medicaid currently do not provide coverage for genetic counseling, but some private insurers do. If you are considering genetic testing, please speak with your Advanced Urology Centers of New York provider. We understand this is a very personal decision and want to help you determine if it is right for you.